She walked past her bowl this morning. You put fresh food down. She sniffed it and walked away. You told yourself she is being picky, that she will eat later. But what if later is already too late? Most cat owners do not know this. A cat who stops eating is not being fussy. She may be closer to a medical emergency than you realize, one that veterinarians describe as one of the fastest and most preventable causes of serious illness in domestic cats. It has a name. It is called hepatic lipidosis, and it can begin affecting your cat's liver before you even realize something is wrong. This video could save your cat's life. Please watch it to the end. What is happening number 6? Why cats stop eating in the first place. Before we talk about what happens when a cat stops eating, you need to understand why it happens, because the reason matters. And some of the most common triggers are things owners accidentally cause without realizing it. Veterinary internists at the American Association of Feline Practitioners have identified the most frequent triggers for sudden appetite loss in cats as abrupt changes in food type or brand, stress from environmental changes, underlying dental pain, nausea from early-stage kidney disease or gastrointestinal illness, and upper respiratory infections that block the cat's ability to smell her food. Since cats rely almost entirely on scent to identify food as safe and appealing. This last point is critical and frequently missed. A cat with a blocked or congested nose effectively cannot smell her food, and a cat who cannot smell her food will not eat it. If your cat has recently had any sneezing, watery eyes, or nasal discharge, and has now stopped eating, the connection between those two things is not a coincidence. Identifying the reason behind the appetite loss is the first step. But regardless of the reason, the clock starts the moment she stops eating. What is happening number 5? What is already changing inside her body? Your cat has not eaten for a full day. She seems okay. She is resting, maybe grooming. But inside her body, something may have already begun. In cats, particularly overweight ones, going without food can trigger a condition called hepatic lipidosis, or fatty liver disease. Unlike most animals, cats have a limited ability to process fat reserves during periods of food deprivation. Their bodies begin mobilizing fat from tissues and sending it to the liver for energy conversion, and the feline liver can become overwhelmed by this process more quickly than most owners realize. This is not a condition that announces itself loudly. It develops quietly, and it does not stop on its own. The longer a cat goes without adequate nutrition, the greater the strain on her liver. A day without food is not something to watch and wait on in a cat. It is something to act on. What is happening? Number 4. Why time matters more than most owners realize. There is a reason veterinarians keep returning to the same message when it comes to cats who stop eating. Early intervention leads to significantly better outcomes, every time. Veterinary specialists consistently emphasize that cats who receive proper nutritional support under professional care early in the course of appetite loss recover far more successfully than those whose owners delay seeking help. The longer the gap between appetite loss and treatment, the more the body has had to compensate, and the harder the recovery. Most owners who look back after a difficult outcome say the same thing. They thought she would come around. They waited to see if she would eat by morning. They did not want to overreact. You are not overreacting by calling your vet after 24 hours. What is happening number 3? The signs most owners miss until it is too late. This is where the cruelty of this condition becomes clearest, because hepatic lipidosis does not announce itself loudly. It creeps, and it looks different in every cat. Veterinary hepatologists note that the clinical progression of feline hepatic lipidosis varies significantly between individual cats, depending on factors including age, weight, pre-existing health conditions, and the underlying cause of the appetite loss. Some cats may show concerning signs within a couple of days. Others may appear outwardly normal for longer while significant changes are occurring internally. This individual variation is exactly why a fixed timeline is misleading, and exactly why early action matters more than waiting for a specific symptom to appear, and the sign that tells you the situation has progressed significantly: a yellow or jaundiced tinge inside the ears or in the whites of the eyes. By the time jaundice is visible, the liver has been under serious strain for some time. You do not want to wait for jaundice. You want to act long before it is even a possibility. What is happening number 2, what the vet will do, and why speed changes everything. You have called the vet. You are going in. Here is what to expect, and why getting there quickly changes your cat's outcome dramatically. Veterinary treatment for hepatic lipidosis centers on nutritional support, specifically getting adequate calories back into the cat's body under professional supervision before further strain occurs. Dr. Deborah Greco, a board-certified veterinary internal medicine specialist, has published extensively on feline hepatic lipidosis and notes that early-stage cases treated with proper nutritional support carry excellent prognoses when caught before significant damage has occurred. The liver is a remarkably regenerative organ in cats when intervention begins early enough. The vet will run blood panels to assess liver function, check for underlying causes, and determine the safest approach for your specific cat. Important: never attempt to syringe feed or force feed your cat without explicit instruction from your vet. Force feeding at home without veterinary guidance can cause additional stress, food aversion, and in some cases aspiration, which makes the situation worse rather than better. Trust your vet's assessment. Follow their specific guidance for your cat's situation. Cats who receive early, appropriate veterinary nutritional support frequently make full recoveries, but only when the right help comes at the right time and from the right hands. What is happening number 1? What you must do right now. Everything in this video has been building to this moment because information without action cannot save your cat. So here is exactly what to do. Starting now. The Cornell Feline Health Center and the American Association of Feline Practitioners both provide clear guidance. Any cat who has not eaten for 24 hours should be seen by a veterinarian within that same day. Do not wait for 48 hours. Do not assume she will eat when she gets hungry enough. Contact your vet and describe what you're seeing. Let them guide the next step. Step 1. Note the exact time she last ate. Write it down. Step 2. If it has been 12 hours with no food, try offering strongly scented alternatives. Warm the food slightly to enhance smell. Try a different texture or low-sodium broth as an appetite stimulant. Step 3. If it has been 24 hours with no food consumed, call your vet immediately, not tomorrow, today. Step 4. While you wait, keep her warm, calm, and away from stressors. Do not attempt to force feed. Step 5. At the vet, be specific. Tell them exactly how long she has not eaten, any recent changes, and every symptom you have noticed, even small ones. Your cat cannot tell the vet how she feels. You are her voice. The more precisely you speak, the faster she gets the help she needs. 24 hours. That is your threshold. Not 48. Not 72. 24 hours. And you call the vet. Your cat cannot read the calendar. She cannot count the hours. She cannot tell you that something is wrong inside her body. All she can do is stop eating. and hope that you understand what that means. Now you do. If this video made you look at your cat's bowl differently today, please share it with every cat owner you know. It may be the most important thing you share this week. Subscribe to Cat Code Relevated. We are here every week because your cat deserves an owner who knows what to watch for before it is too late.